Here we go, Chapter 20, Vehicle Extrication and Special Rescue. So, introductions. Some special rescue situations, they include a lot of different things. Some of those might come to mind for you would be water rescue or maybe diving problems, even ice rescue, confined space rescue, some farming emergencies, bus collisions. All of these kind of things are all types of special rescue situations that can be life-threatening, both to the rescuer and the patient. So each of these, not each of these, but in each of these situations, your first objective, as with everything, is to maintain your own personal safety. So that scene safety is going to be very important. So we talk about extrication. You'll need several hours of practical exercises to become skilled in the process of extrication. You guys should be getting that at your department, where you're, even playing some games with tools and using those and becoming better and better with those. So you should be familiar with extrication equipment, its use, the hazards involved in the extrication process. Now, ideally, when we're talking about when you're actually using these tools in the field or even in training, you should wear protective equipment, similar to what you wear on a fire call. So everything including a coat, pants, boots, helmet with face shield, your gloves. Minimally, though, a helmet with a face shield or goggles and gloves should be worn. A lot of that will probably be dependent upon, your minimums at least, on what your department recommends/requires. So some basic guidelines to extrication. So to ensure the best care for the patient, many different agencies are going to need to cooperate. You have everything from law enforcement, from securing a scene and shutting down the roadside, to fire, extricating the patient, to EMS taking over the patient and taking them to the hospital. A lot of different things, so we need to be able to work well together. So keep in mind the following basic guidelines. So know your own limitations of your training, your equipment, and your skill level. Make sure that you identify any and all hazards, and then when you do, control those hazards for which you're trained and equipped. So you're going to gain access, provide patient care, and then only if necessary are you going to move the patient prior to EMS getting there to move the patient, take over. So as an EMR, you have the following two primary extrication goals. One is to obtain safe access to the patient. The other is to ensure patient stabilization. So overview of the scene. Step one, we need to conduct a scene size-up. So as soon as the dispatcher tells you of the incident, you need to begin to anticipate and plan for what you're likely to find on arrival. We know that when you go on the highway, we're likely to find a lot of debris, maybe somebody trapped that needs extricated. There's going to be cars coming both directions, a lot of different things, so history, usually the history of us running calls and all of that is what dictates a lot of this, of what we think about because of experience. So use your knowledge in these things, but also be flexible. When you think about all of what could or could not happen, we need to be flexible in planning. So if dispatch information is complete, you're going to know a couple of different things. Which types of vehicles are involved, whether they're injured or trapped, occupants, or if the vehicle's burning, for example, or maybe even hazardous materials that are present. So as you approach the scene and before you exit your vehicle, get an overview of the entire accident scene, or the entire incident. Rapidly determine the extent of the accident or incident. Right away, we should start figuring out some things of, whether we think this person is sick or not sick, or stable or unstable, essentially. So we want to determine the extent of the accident, try to estimate the number of patients, locate any hazards, and then also we want to call for whatever assistance that we're going to need in the incident. So when we approach a scene, we want to make sure that we're looking over the entire scene on here. You see you've got fluids out, you've got a hazardous intersection, you have a lot of different stuff going on. Infectious diseases. So when we're going to go on to step 2, which was stabilization of the scene and any hazards. So we want to keep a sharp lookout for hazards that can result in injury or disability or death. And with that, as I mentioned, we're going to talk about infectious diseases. So many patients involved in motor vehicle crashes will have soft tissue injuries and have some active bleeding, as you already know or can imagine. So we're always want to follow standard precautions at all motor vehicle crash scenes. So make sure we're wearing gloves, face shields if possible. There may be a time where you need to put on if you have access to a gown, so you're just not getting stuff through your outfit. You want something that's non-permeable to get fluids and stuff through there, to get them on your skin. So if sharp glass or metal is present, we're going to wear heavy-duty leather gloves or over latex or even vinyl gloves. If there's danger of splattering blood, you want to consider, as I mentioned, using some face protection. So traffic hazards, we're still talking about stabilization. Park your vehicle and other emergency vehicles so they protect the scene and warn oncoming traffic to avoid the crash site. You want to consider the design of your vehicle's warning lights and park so you can use them to the best of your best advantage. Always wear an approved safety vest and your PPE. Use some warning flares if possible. And then you definitely want to survey the scene for other hazards as these things evolve. So bystanders, they're going to be there, as you can imagine. You want to keep them away from the crash scene. And you need to give them very specific directions. If you just say go away, that's not going to be very good, because they're not going to just go away. You need to give some very clear directions of, stand over there, maybe involve police or fire, somebody else within your system to tape off an area or get people, out of where you need them to be. Of course, on spilled fuel, when we're talking about hazardous scenes, you should expect to find a fuel spill if a motor vehicle has been hit near the rear, if it's on its side, or if it's upside down. There's a really good chance that you are going to find some fuel on this crash scene. Still talking about stabilization. So if a fuel spill is present, you definitely want to call the fire department. Maybe that's you, or maybe that's another responding agency. If patients are in a motor vehicle with a fuel spill and the fire department has not arrived, consider covering the fuel with dirt. Moving on, talking about motor vehicle batteries. So reduce the possibility of an electrical short circuit by turning off the vehicle's ignition. It's good to get that ignition source, away from all the fancy stuff. Do not attempt to disconnect the battery unless you have been trained in the proper way to do so and have the necessary tools. And one thing to think about, and probably a lot of you know, these hybrid vehicles or electric vehicles, many of them have a very large quantity of batteries. So you've got to be pretty thoughtful about those. Moving on to some downed electrical wires. So these things can be caused by a number of reasons. It can be caused by high winds, ice buildup, or even a vehicle hitting the utility pole. So what we need to do is when we pull up, we need to make sure that we locate where the wires are and then avoid them at all costs. So if a vehicle has a downed wire across it and passengers are trapped inside, then we need to immediately instruct the passengers to stay inside the car. We also need to keep all the bystanders away from the vehicle and then call the utility company for assistance. Hopefully somebody has already done that. And then if you are not the fire department, you need to call the fire department for assistance. So be sure to check everywhere, including under vehicles, for these electrical hazards. Now, talking about unstable vehicles, we need to assume that every vehicle involved in a crash is unstable, unless you've manually stabilized it. So if you've used cribbing and you've, blocked everything up and you have it to where it's stable, you know that it's stable. Otherwise, these things should be considered unstable. Now, we're not talking about just a car that's in the middle of the intersection sitting on its four tires normally. We're talking about something on its side or upside down or whatever, or maybe even on an embankment. So, vehicle on its wheels, ensure stability by choking the front or back wheel with hubcaps or pieces of wood, so making sure that thing's not going to move forward or backward. If you can gain access to the inside of the vehicle, place the transmission in park and set the parking brake to prevent the vehicle from moving. You can even deflate the tires if you wanted to, if you're concerned. I'm not sure when you might do that, but if you were, maybe on a steep embankment or something like that of concrete to where it wouldn't start sliding. But, you know, in the event you needed to, that's something that you're able to do. So you're able to see here that talking about chalking the wheels over on the left, and then obviously deflating the tires to help stabilize the vehicle. So still talking about stabilization, vehicle on its side or upside down. Stabilizing a vehicle on its side is beyond the range of skills and equipment for many EMRs. If you must enter the vehicle to respond to a life-threatening situation, don't climb on the vehicle. You want to go ahead and be careful when breaking that rear window glass, and then enter through the back of the vehicle. And you bend over or crouch down to stay close to the ground. And then upside down vehicle is relatively stable, but as we said before with the spilled gas, that's going to be your primary hazard, is that spilled gas. Vehicle fires. Impact fires occur when the gas tank ruptures during the crash. So the vehicle is usually rapidly engulfed in flames, and it soon becomes impossible to approach it for a rescue attempt. So passengers are usually rescued by bystanders and witnesses to the crash. Now, post-impact fires are often caused by electrical short circuits and can be prevented by turning off the ignition. That's what we were talking earlier about, making sure we can do that, or trying to. Now, should a fire occur, turn off the ignition, extinguish the fire with a portable fire extinguisher, and then try to get remove the passengers from the vehicle as soon as you can. Emergency actions for motor vehicles. So use a dry chemical fire extinguisher. Immediately have someone else gather fire extinguishers from other vehicles at the scene. Use the extinguisher to keep flames out of the passenger compartment. Emergency actions for motor vehicle fires continued. So do not be overly worried about discharging the extinguisher onto the passengers. It's a dry chemical powder, and it is non-toxic. So you want to remove patients as quickly as possible, but take care because they may have sustained injuries. So move everyone at least 50 feet from the vehicle that's on fire, and then stay away from the front and rear ends of the burning vehicle. So moving on, step 3, access to the patient. So access through the doors. Between 85 and 90% of all patients found in motor vehicles can be reached simply by stabilizing the vehicle and then opening a door or rolling down a window. So you want to try all the doors first, even if they appear to be badly damaged. Make sure the locking mechanism is released. Try the outside and inside handles at the same time, as you see him doing there. So in the event you need to, you can move on to the window. So don't try and break and enter through the windshield. It's made of a plastic laminated glass. The side and rear windows are made of tempered glass and will break easily into small pieces when hit with a sharp pointed object. That's what you can see in that picture. It's tempered glass. So you'll want to carry a spring-loaded center punch. Probably most people carry these in their kit. So if you must break a window to open a door or gain access, you want to try to break one that is farthest from the patient, because we don't want all of the glass particles to go all over our patient if possible. Advise the ambulance personnel if a passenger is covered with broken glass. Now, after breaking the windows, use your gloved hand to pull the remaining glass out of the frame, and then try to unlock the door again and access a vehicle in the window. If you want to do that in your book, you should have a skill drill on there that talks about that. Access through the windows. When you gain access to a crashed vehicle, be alert for undeployed airbags. If you cannot gain access to the vehicle, do what you can to assist the patients. So stabilize the vehicle and then protect the scene until your proper equipment arrives. Now, once we start talking about some medical stuff, so conduct your patient assessment. You want to look at the ABCs. We'll want to control bleeding. Want to treat the patient for shock. Stabilize the cervical spine. Provide emotional support if possible. Maintain the patient's body temperature with a blanket. But that's a lot of the part where we say we're going to treat for shock, right? Because we're going to keep them warm. Initial emergency care. So leave the patients in the vehicle unless it's on fire or they are in immediate or otherwise in immediate danger. Now, patient disentanglement. This process usually requires tools and specialized equipment. So in some serious extrication situation, disentanglement can take up to 30 minutes and requires advanced training. Now, disentanglement, still, we talk about the golden hour. And so we want to use the golden hour when we manage serious trauma situations. So the less time spent at the scene with a seriously injured patient, the better. We want to get that person from the time the crash happened and be to the ER within that hour. So and hopefully the EMS crew can drop them off at the ambulance. I mean at the ER, or a helicopter can drop them off at the ER within that hour. So the patient's chance for survival increases if the rescuers can get the patient to definitive care as soon as possible. So we're talking about preparation for patient removal. As disentanglement proceeds, dressing, bandages, splints, all of that's applied, and the patient's head and spine are stabilized. So the access route used to care for the patient may not be adequate as an extrication route. You may not be able to use that as getting them out. The way that you went in, you may not be able to get your patient out. So the extrication route must be large enough to permit the safe removal of the packaged patient. Now, once the patient is packaged, he or she is removed from the vehicle and placed onto the stretcher of the transporting ambulance. Although you are directly involved in only the first 4 of these 7 extrication steps, you do need to be aware of this entire process. So, talking about a review of this process, call for additional resources and help. Specify the number and type of vehicles involved. Do not stand idly by while waiting for help, so we need to identify and contain some hazards. Park your vehicle so its headlights and warning lights can be used to protect the light and light the scene. Clear a working area around the site of the crash before you or rescue personnel attempt to stabilize the vehicle. So when we're talking about doing this, make sure you use your head. Think about what tools that you already have versus what tools you may need. Try opening those doors first rather than breaking windows. Always try before you pry. Once you gain access to the patients, assess and monitor their conditions. Definitely, it's hard at these times, but you definitely want to remain calm. I think I skipped a bit. Here we go. Sorry about that. I just got on a roll. So, water and ice rescue. Water rescue. The person in the water may be fatigued, so they may have sustained a diving injury or may have even fallen through ice in the water. So jumping in the water to save someone obviously can endanger your own life. So remember these steps. Reach. Use any readily object. If the person is close to shore, a branch, pole, or paddle, all of that stuff may be long enough to reach them with that rather than jumping in. Throw, so at a swimming pool or a dock or a supervised beach, there may be a good flotation device. If there is one, wherever you're at, get that to them. Some public safety departments carry a specially constructed rescue throw bag that contains a rope. The next step, row. So row out to the drowning person if a small boat or canoe is available. Once again, we've harped on it a lot, but scene safety is important. Your personal safety is going to be the most important thing here. So we row out to them if we can. Consider this option only if you know how to operate or propel the craft properly, and then protect yourself by wearing a flotation device. Whoops, I think I skipped a part here. Oh, no, I did row. Yeah, I'm sorry. Go. So as a last resort, you may have to go into the water to save the person. So enter the water only if you're a capable swimmer trained in life-saving techniques. If you are not trained in life-saving techniques, if you've not been through lifeguard training or some type of swimmer survival training, you may have a real hard time doing this because there are certain ways that enable you to be able to move someone to the shore in a safe fashion. So enter the water only if you're a capable swimmer trained in life-saving techniques. Remove encumbering clothes before entering the water, and then if there is a flotation device, make sure that you take it with you. And here's just a picture of what we've been talking about. So reach, throw, row, and go. So the initial treatment of a person in the water. Things we're going to do, we're going to open the airway. We're going to establish breathing and circulation, and then we're going to stabilize spinal cord injuries in those situations. We're going to use the jaw thrust maneuver to open the patient's airway. One thing we want to think about is do not hyperextend the neck. We want to look, listen, and feel for signs of breathing. So we're looking to see if we see chest rise and fall. We're listening to hear air moving. We can also feel on there for chest rise and fall and chest wall expansion, all those things. So if the patient is not breathing, we want to start rescue breathing while the patient is still in the water. This is, once again, this is where the training part comes in. If the patient has experienced cardiac arrest, quickly stabilize their head and their neck. Now, get them out of the water, place them on a hard surface, and begin CPR. Treat any patient who is unconscious in the water as if he or she has a spinal cord injury. So what we're saying is if they're unconscious in the water, we are going to treat them like they have a spinal cord injury regardless. Until proven otherwise, they do. So assume the presence of a spinal cord injury if they're present in the water, so we're talking about that they're conscious, that they report numbness or tingling in their arms or legs, if they're unable to move the extremities, or they report neck pain, that we're going to suspect that they have one as well. So we want to strap them to a backboard, stabilize the head and neck, remove the patient from the water. So here you can see they're putting this person on a backboard while they're in the water. Diving injuries. So most recreational divers use SCBAs or scuba, self-contained underwater breathing apparatus, and that consists of an air tank, a regulator, a mouthpiece, and a face mask. Now, most underwater diving accidents occur in coastal regions, as you can imagine, or in areas with large lakes. Diving accidents can cause trauma, near drownings, or even specialized injuries. So we've got to be careful about those. When we talk about specialized injuries, you know, they can be associated with diving, include air embolism or decompression sickness. And what happens is you get these air bubbles that are being released in the body as a result of pressure change while diving. So if an air bubble affects the brain or the spinal cord, the signs and symptoms may be similar to those of a stroke. Dizziness, difficulty speaking, difficulty seeing, decreased LOC, all of those kinds of things. If the air bubble causes a collapsed lung, you're going to see some chest pain, shortness of breath, pink or frothy blood coming from their mouth. The thing we want to do about that, maintain the patient's airways, breathing, and circulation. So A, B's, and C's, and then we want to try to keep them warm. Get O2 on them as soon as possible. And if you're able to, you might get them on the left lateral recumbent position in the event some stuff needs to come out. But remember that if you're suspecting a head injury, that may not be such a great idea. So when you're talking about an ice rescue, as a rescuer, no ice is truly safe. So ice rescue is extremely hazardous because of that reason. So don't exceed the limits of your training and do not put yourself at undue risk. Visually mark the location where the person was last seen so other rescuers can concentrate their areas on a limited area. And with this, we're saying the basic rules of ice rescue are the same as for water rescue. So reach, throw, row, and go. Reach for the victim using anything. Throw that flotation device or a rope or something like that. Row or propel a small boat. But if you must go, secure yourself to the shore with a rope around your waist. Lie on your stomach and then proceed across the ice. Now, doing that, by spreading your weight over the wider area, that does reduce your chance of falling in. Motor vehicle on the ice presents a risky situation, so instruct the vehicle's occupant to avoid unnecessary movement. If the vehicle has not gone through the ice, instruct the occupants to open the vehicle's doors. If the doors can't be opened, they need to roll down the windows so they'll have a better escape route. During ice rescues, both of the persons on the ice or in the water, or the rescuers, everybody's at risk for hypothermia. So everyone needs to be kept warm. Rescued persons should be stripped of wet clothing, dried and warmed as soon as possible after they are removed from the water. So if the patient has no pulse, we're going to start CPR and continue until the patient has been transported to a hospital and warmed. So confined space rescue. Confined spaces are structures designed to keep something in, or it's designed to keep something out. So these things can be below ground or ground level or even elevated. So below ground include manholes, old mines, wells, different stuff like that. Ground level confined spaces include industrial tanks, farm storage silos. Elevated as water towers, storage tanks. So rescue situations involving confined spaces have two deadly hazards. You have respiratory hazard and you have a collapse hazard. So respiratory hazard, the confined space may have insufficient oxygen to support life, or even a poisonous gas may be present. So rescuers must never enter a confined space without proper respiratory protection. Now, in a collapse hazard, in a mine, rescuers may need to shore up the confined space before they can safely enter. But in any confined space situation, call for additional assistance and don't enter the space until your help arrives. Here's kind of what we've been talking about. Farm accidents pose many challenges. So reporting of an emergency may be delayed if the farmer works alone. It may be a lengthy response in getting to a farm. It may be hard to pinpoint the exact location of the emergency. And then poor roads or non-existent roads and muddy soil, all these things, it may cause you to leave your vehicle some distance from the patient. So with more talking about different hazards, obviously animals can seriously injure the farmer, pose a risk to the rescuers. Farms contain a wide range of hazardous chemicals, so pesticides, herbicides, fertilizers. Then farms use many types of electrical powered machinery. So you want to be thoughtful about shock hazards and all of that around these scenes. And then even some accidents have involved tall barns and silos. So these things are going to require rescuers that are trained in high-angle rescue techniques. So silos should always be treated as hazardous confined spaces. Now some farms include below-grade manure storage pits, which are filled with poisonous gas or are deficient in oxygen. So accidents with farm machinery usually involve rollovers of farm tractors, entrapment in machinery, severing of body tissue by sharp objects. Now, your role in this is going to be to stabilize the scene, provide initial medical care for your patient, and then follow the 7 steps of extrication. We've talked about those. That scene, careful scene size up, shutting off electrical power if possible, call for adequate assistance, stabilize the hazards. If possible, gain access to your patient. Once we're there, we're going to establish responsiveness and worry about the ABCs. We're going to try to control their bleeding and try to keep them warm the best that we can. Last topic, a bus rescue. So because of a large number of people being transported by buses, bus crashes happen to occur in many communities. So crashes involve buses are considered multiple casualty incidents. So our role is going to be to perform a scene size up, call for the right resources, whether that's PD, fire, and EMS, and probably going to be all 3, and then establish an incident command system if multiple casualties are present. So set up a one-way traffic pattern for responding vehicles to avoid congestion and gridlock. And then with a large number of patients, triage the patient using that START triage system that you have probably talked about, or if not, it will be in the next one. And that's it. So I just did that one. So that's it. That was chapter 20.